Here's some questions to ask your gynecologist in your 30s from a gynecologist. First up, fertility. You need to ask questions about how age is affecting your fertility, your ability to be pregnant, talk about preconception counseling. Do you need to get any fertility tests? Do you need fertility testing? Do you need to consider freezing your eggs depending on your trajectory or your plan for pregnancy? 2, birth control. If you're not planning on being pregnant but want to make sure that you are on a good birth control contraceptive plan, then now is a good time to talk to your doctor about what are the best options for me, especially considering, whatever medical comorbidities you may have. And I'm talking medical issues like, have you had a history of blood clots? Do you have a history of sickle cell? Do you have a history of lupus? All of those things are important to discuss. 3, hormonal changes. Discuss how your hormones are changing, how they're affecting your mood, your overall health, and should you be monitoring your hormone. 4, screenings. How often should you be getting pap smears? What are the implications of abnormal pap smears? Other healthcare screenings like sexually transmitted diseases, STIs, gonorrhea, chlamydia, trichomonas. It's important to talk about all of these things and how they are affecting your life in general and the frequency of their screening. How often should you be getting glucose screening or an A1C to make sure there's no concern for diabetes, thyroid screening, all questions you should talk to your doctor about. 5, a really important one, breast health. Breast self-exams, breast awareness. When should I be getting a mammogram or should I be getting a mammogram? Discussing your personal history, including your family history, understanding your risk factors, talking about genetic screening if there's any concern for genetic diseases in your family. 6, menstrual changes. Along the lines of like hormonal changes, it's important to discuss how your menses are changing and how you should be monitoring those. You should be asking, is it normal for your period to change? And the changes that you're noticing with your periods as you transition from your 20s into your 30s. Lastly, bone health. It's important for you to think and talk about, how your medical comorbidities are affecting your bone health and, what are you doing with respect to exercise, mental health. All of these things are important for you to discuss.